All right, Allison.
All right. Well, hello, everybody. My name is Allison Agwu, and I'm the program director for our JH Wiki Part D program. And welcome to our JH Wiki Toolkit series. A little bit of brief housekeeping before we get started. Please, when you're not talking, please put your camera. You can leave your cameras on. We love to see your face, but definitely put your microphone on mute so we don't have the interruptions. But really looking forward to our Toolkit series today. Let's get started. Our Toolkit series, if you have not joined us before, is to engage and amplify a little bit about who we are. Like I said, I'm Allison Agwu. I'm a professor of adult and pediatric infectious diseases and the program director of the JH Wiki program. We're six, distinguished programs who provide quality care, comprehensive care for family-centered care and social services for women, infant, children, and youth, our Wiki. And these are the names of the programs here: University of Maryland, our HIV Women's Health Program, Sinai, University of Maryland, Emerge Clinic, and HIV Psychiatric Services. The vision really is to provide more coordinated response to HIV care, thinking about how to mutually work together to provide relationships, then collectively increase the quality of care that we provide as a community. The mission for this series and what we do is to build upon what we all are doing to work together, again, to coordinate across multidisciplinary systems of care. This is our signature platform to share and engage. And our goal here is to amplify all of you. There's expertise in everything that we do. And so we want to engage you and then amplify the expertise. So if you see something, say something, send us a message and tell us you'd like to come and share. Next slide, Marinas. So in that vein, I'm going to start first with Dr. Sarah Rives, who actually did a recorded talk because she was so excited to be here today, but she couldn't actually be here in person, or she may join us depending on what her clinical care looks like. So today it's PrEP Tales, enhancing PrEP uptake through storytelling. Sarah Rives is going to start. We have Dr. Mickey Dhir, who's also going to be here. But we'll start with Sarah, who's going to introduce why we are here. Sarah's a nurse practitioner who provides HIV care through the Johns Hopkins County program. Previously was a medical director for the HIV PrEP, Hep C at the Baltimore City Health Department, sexual health clinics. She has a background in HIV-related public health work in the Dominican Republic, where she also serves as a Peace Corps volunteer. She received her clinical training at Columbia University and provided primary care services at an FQHC in California prior to coming and staying in Baltimore. So we'll have Sarah start her talk, and then we'll go from there. Hit it, Marinas.
Hi, everyone. I'm really honored to be invited to speak a bit today to set the stage with the PrEP landscape in Baltimore for this event about enhancing PrEP uptake through storytelling. My name's Sarah Rives. I'm a nurse practitioner and have been working in the HIV field since about 2007. And previously was the medical director for HIV and PrEP and Hep C services at the Baltimore City Health Department sexual health clinics. And I'm currently a nurse practitioner doing patient care and seeing patients with HIV and providing PrEP. Let's get going. So first, when we're thinking about the PrEP landscape and how well we're doing at providing access to PrEP in Baltimore, we need to think about new HIV diagnosis and who are the people who we're missing with that intervention to prevent new diagnoses. So broadly in the United States, this is data from the CDC for new diagnoses in the US and the most affected subpopulations. This is the most recent data available in 2021. We can see that Black or African American male-to-male sexual contact are still the group predominantly affected by new HIV diagnoses, followed by Hispanic or Latino male-to-male sexual contact, white male-to-male sexual contact, and then Black women heterosexual contact, Black men heterosexual contact, and Hispanic or Latino women heterosexual contact. People who inject drugs make up about 7% of new diagnoses. Focusing in Baltimore, this is similar as far as the subpopulations and that risk category, those categories assigned by CDC that we use for epidemiologic data to understand new diagnoses in Baltimore. You can see on the graph on the left that new HIV diagnoses have been going down over time. So from 1985 until 2022, we see new diagnoses decreasing. but almost plateauing off a little bit. And then on the right-hand graph, of proportion of those new diagnoses based on different exposure types. So the yellow bar is male-to-male sexual contact. The red line is injection drug use. And the green line is heterosexual contact. So still male-to-male sexual contact is the predominant exposure that we're seeing for new diagnoses, but really a lot of people through heterosexual contact are acquiring HIV in Baltimore, as well as still people whose risk involves injection drug use. Going further into new diagnoses in Baltimore, male sex at birth makes up almost 80% of new diagnoses, and looking at race and ethnicity, 83% of new diagnoses are Black or African American, whereby the population that is Black or African American in our city is about 61%. So huge racial disparities in new diagnoses. And as far as age, we see that more than 50% of new diagnoses are under the age of 34. So in 2022, there were 158 people diagnosed with HIV in Baltimore. And really, those are all people with different stories, different ways that they could have been exposed to HIV. And we have the tools to prevent these infections. PrEP is one of those tools, or HIV pre-exposure prophylaxis. So let's just go back and look at the history of PrEP in the US. Starting in 2012, tenofovir with emtricitabine or Truvada was approved by the FDA for PrEP. And then in 2019, a newer form of tenofovir with emtricitabine, or brand name Descovy, was approved by the FDA for PrEP. That excluded people whose risk involves receptive vaginal sex, just based on who that medication had been studied in. And then in 2019, the USPSTF, or the United States Prevention Services Task Force, gave PrEP a grade A recommendation. This was really important because it, based on policy, allows for insurance companies to need to provide this medication without cost sharing based on the Affordable Care Act. Oops. And then an FAQ was issued by the federal government in 2021 to reinforce that. Also in 2021, injectable cabotegravir, long-acting, or brand new Apretude, was approved by the FDA. This table just outlines the different types of exposure that someone could have to HIV and the different medications that can be used for PrEP and have been studied to show that they're effective for prevention. So along the top, TDF, FTC, or brand name Truvada is effective for all types of ways that someone might be exposed to HIV, all types of sex, injection drug use. On-demand PrEP is not approved by the FDA, but has been shown to be effective using TDF FTC only for excluding people whose risk involves receptive vaginal sex. So this is also called the 2-1-1 method. And you can see here where it can be effective. Daily oral TAF FTC or Descovy can be used, except for women or people whose risk involves receptive vaginal sex, and then intramuscular injectable cabotegravir for anyone involving sexual risk. So we see in the US how much PrEP use has increased from 2012, when the first medication for PrEP was approved, until 2022. PrEP users increased by over 4,400% in that 10-year period. However, there are extraordinary racial disparities in that use and inequity in how much there is access to these medications. So among the people who could benefit for PrEP, only about 30% were prescribed PrEP in 2021. And you can see that looking at racial disparities, about 11% of the people who could benefit from PrEP who are Black or African American are actually prescribed it, 21% for Hispanic or Latino individuals, 78% of white individuals who could benefit from PrEP are receiving it. So we have a lot of work to do around racial disparities. PrEP use in Baltimore City most recently. This is a great success looking at how much PrEP use has increased over time and continues to increase. So as of 2022, we have over 1,000 people using PrEP, and the proportion of users who are male sex at birth is about 86%. So women make up about 13% of PrEP users, but about 22% of new HIV diagnoses. And then looking at age, young people make up about, between the ages of 13 to 24, make up 11% of PrEP users, but 25% of new HIV diagnoses. So this is a really helpful resource called AAHIVS that puts epidemiologic information into nice visual formats. And they have a way to calculate something called the PrEP to need ratio, or how many PrEP users are there to every new HIV diagnosis in that particular category. And this PrEP to need ratio, as it goes higher, the better. So there are more PrEP users for every diagnosis. We're not quite sure what the ideal number of PrEP users should be to every HIV diagnosis to be able to prevent all diagnoses, but the higher the number, the better coverage for PrEP. So looking at the PrEP to need ratio has been increasing, which is good because PrEP use has been increasing in Baltimore, but there are disparities. So for example, between sex at birth, males, the PrEP to need ratio is over 7, but for women it's 4. And then by age, again, ages 13 to 24, we have work to do to increase that PrEP to need ratio. The data didn't get, because of the granularity and the lower numbers in Baltimore City, didn't have race and ethnicity displayed, but looking at Maryland, they did have the PrEP to need ratio available for race and ethnicity. Again, as I had mentioned before, huge racial disparities in PrEP access and use, with Black individuals having a PrEP to need ratio a little over 4, and white individuals 10 times higher at 44. And Hispanic or Latinx people at around almost 6. Ending the HIV epidemic is a national effort and lots of funding streams to hit different pillars related to prevention, treatment. And so there's a dashboard with great data, and you can see where we are tracking towards progress at goals. So for Baltimore City, there's a goal for PrEP coverage to get to 50% of people who could benefit from PrEP being prescribed it by 2025. Right now, we're at about 17%, and you can see how that's gone up slowly over the last several years. Looking back at kind of where the denominator is for these types of metrics is really who could benefit from PrEP. And it's hard to pin down how different groups define that when we're looking at data. And I think it's an important piece of how we look at how well we're doing. So the CDC PrEP guidelines from 2021 updated their kind of box around who could benefit most from PrEP. First, they put out a statement or a sentence in their guidelines saying all sexually active adult and adolescent patients should receive information about PrEP, which was a big change from previous initial PrEP guidelines. And then the box was really simplified to have appear sexually active adults and adolescents, and then people who use drugs. So among people who are sexually active and have had anal or vaginal sex in the last 6 months, anyone who has an HIV positive sex partner, especially if there's an unknown or detectable viral load, they've had a bacterial STI in the past 6 months, or have had a history of inconsistent or no condom use. So very much simplified. And then for people who inject drugs and have an HIV positive injecting partner or share equipment. There are a lot of different guidelines and lists of kind of who could benefit from PrEP. So New York State has a different list of guidelines that go into more detail about sexual and behavioral risks, but also has, I think, what's an important bullet point that says someone who self-identifies as being at risk without disclosing specific risk behaviors. These types of risk assessments require someone to be asking questions and getting a good sexual history, which we know just doesn't happen regularly. So thinking from a healthcare and public health perspective about what are some facilitators and some barriers to enhancing PrEP access and coverage. From the facilitator point, task shifting has been really important for the work that I've done with the Baltimore City Health Department, and making sure that we don't need to have prescribers as gatekeepers to PrEP, that we can utilize other members of the healthcare team to provide access, like nurses, thinking about diversifying those access points in the barriers column. We need to have pharmacies involved, community-based organizations, mobile units, telehealth, school health, emergency rooms, correctional facilities, syringe service programs, anywhere someone might be engaging in a type of service where they might get an HIV test or could potentially get sent to get blood drawn and can get a prescription. Should be points where people can access PrEP, not just at a clinic or an infectious disease specialty clinic, but in primary care and other places. Having champions at that clinic and organizational level is hugely important. For example, we have PrEP nurses at the Baltimore City Health Department that have cell phones, and patients feel comfortable communicating directly with their nurse when they have issues. And we have seen that being used as a way to get kind of word of mouth out and like refer other friends because they've developed a relationship and felt comfortable with someone. We also have that champion as like our data person, or someone who's saying, okay, how do we really look at how we're offering PrEP and expand how we're doing it? So going back to that, who is a good candidate or who should be offered PrEP? There's a lot of bias in the healthcare system and racism in the healthcare system. And so using our electronic medical records and data to really assess how we are having conversations about PrEP and offering it and making sure it matches just on a data level. Okay, anyone who's had gonorrhea or syphilis in the last 6 months should have had that conversation. So are we missing, for example, women or Black or African American patients because we're not having those conversations about PrEP and looking at it just on a data level. And then we've another facilitator, we're seeing increasing options for PrEP. It's not just TDF, FTC, or Truvada once a day, and that's your only option. We have on-demand PrEP, we have injectable PrEP, and there will be more options to come. Probably the biggest barrier from the healthcare and healthcare provider perspective is the complex system for medication coverage and just our complex health system in general. We've seen issues around privacy for youth and their concerns about knowing, like parents knowing that they are receiving these services. We've had tons of issues around assistance programs for the uninsured or copay assistance, which are great programs, but they require a lot of staff time to support the patients who are using them. And small barriers and glitches in those programs and in the work that goes into that can really lead to someone deciding that they're not going to continue a medication. Prior authorizations are another issue because these medications are expensive. There's a study I found recently published that it's 16 times more likely for qualified health plans in the South to have prior authorizations for PrEP medications than in the Northeast. And there's not really a reason why that might be. And then visits and lab costs that can add up. So again, I mentioned diversifying access points, and that requires also funding streams for the staff at those at these different access points who can provide support to people to continue or start PrEP. So this really gets into status neutral care. We have Ryan White funding for people who have HIV. We can provide incredible case management and support, but that funding is limited for people who don't have HIV. I'm excited about hearing the stories to come, and I hope to join for questions later. Thanks.
Fantastic. So it's really my pleasure to have had Sarah do that fabulous overview of PrEP, and then to have all the panelists join us. So on the heels of Valentine's Day, we thought it'd be a perfect opportunity to not just hear about PrEP from sort of the data and the perspective that Sarah provided, but really to hear your stories, right? And I think as a provider, I can look at data, but again, the stories are what matters. And Sarah alluded to the fact that there are stories behind everybody. So first, I'd like to introduce Amit, Mickey Dhir, who has many, 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 many letters behind his name. I was going to add another one in terms of a PhD at Johns Hopkins in Baltimore, focuses on HIV and STI management and prevention and primary care from the LGBTQIA populations, leader, community activist and advocate who has partnered with local organizations, including the health department, on many campaigns, and is a PrEP practitioner and is also getting his PhD on acceptability of long-actings for PrEP. I'd like to also welcome Mickey. Nice to have you here. I'd like to also welcome our PrEP experts, and if we can spotlight them, Marina, so they can also join the conversation and panel. We have several young individuals, and I say individuals because Sarah Rives pointed out the challenges and the disparities in PrEP access for young people and for women and for African Americans. And I'll start with Toya Rock, who actually put out the call for people to come and tell their PrEP tales, and got an overwhelming response from, interestingly, a group that we supposedly can never reach, a significant number of Black women. So Toya, why don't you start and then introduce your other individuals, and then we'll start our conversation.
Absolutely. So my name is Toya McCray. I am the Regional Outreach Coordinator here at our Round White Part D program, connecting women, infants, children, and youth to the care that they need. I use PrEP. I started about a year ago, and it was something that I sat and thought about for a really long time. But today I'm happy to be able to answer any questions or to tell my story in reference to why I started PrEP. And once we get into it, we can go there. And I want to throw it over to Terry, if you would like to come on and introduce yourself.
Sure. Hello, everyone. I am Terry Gross. I'm working remotely and moving around, so excuse me not having my camera on. But I just wanted to check in there. Been in the field for a long time working with the round white population, so very well informed. But things change for myself when I also contemplated whether or not PrEP was an option for me. So it's a very personal subject. Also, I'm definitely open to sharing my experiences and some of my challenges, but I'm very excited because some of the points that were made on the slide that were presented, you guys are very on point as to identifying some of the barriers to care. And so I'm more excited to have more conversation around that.
Kesh? Kesh, I should say.
Yes. Hi. I'm Kesh. I'm one of the GTZ case managers here at Chase Bruxton, Mount Vernon. I am a new lead PrEP taker. I'm a month and a half in, and definitely excited to tell my journey into this world. Are we ready to talk now, or just an introduction?
Just a quick introduction to who you are, and then we'll ask you to briefly tell your PrEP tale. So
yeah. So
to Jazmine. Thank you. Jazmine.
Thank you.
Hi, I'm Jazmine Brooks. I'm Toya's daughter. I'm just a high school student, I just want to bring my peers, or just let my peers know about the possibilities they have and how easy it is to catch it. You get what I'm saying? So yeah, I just want to tell my story.
I love that. I think we have Ashley. Did Ashley go already? Is Ashley on? Okay. All right. Did I miss anybody? Because I want to make sure we got everybody. So if you're on the panel and you're going to turn your cameras on, please go ahead and do that. Otherwise, we always say fine with that. So I think first and foremost, thank you for coming and sharing your story. The goal for this is dialogue. And so as much as possible, the people who are in the chat, drop questions in, drop your experiences in. But I want to launch in because again, on the heels of Valentine's Day, hopefully you had a great Valentine's Day if you celebrate that. But I thought it'd be really a great opportunity to talk about PrEP. So maybe some of you alluded to it. Maybe I'll start with whoever wants to jump in. There's so many disparities talked about. How did you hear about PrEP? Many of you were in the field, but then what was it that made you say you were going to take PrEP? Toya, maybe you start.
Well, I had heard about PrEP. I've been in the HIV community caring for people and providing services to people living with HIV for almost over 10 years. And so I've heard about PrEP here and there, but what really made me say, you know, let me go ahead and try it was just the landscape that is here in Baltimore City. We are not aware of everything everyone else does. And so the people that we may encounter, they can tell us what their status is, but unless we actually have that documentation, we really don't know. I felt that PrEP was something that would give me the opportunity to protect myself. And I didn't have to look to someone else to say, you know, this is what I'm doing. I don't have anything. I could utilize PrEP myself and know that I could protect myself in that way. I also know that in the community, you know, sexual fluidity is a thing. And a lot of people, a lot of women that I have met or talked to have ran into situations where they have found out that the people that they were with had different experiences or were experiencing different sexual experiences with different groups of people that would increase their possibility of acquiring HIV. And that is something that I was a little bit nervous about, and I just wanted to protect myself. And if anybody else wants to chime in.
I was going to say, Kesh is brand new, so I'd love to, it's fresh in your mind. So what prompted you? And then I have a question for you, Mickey. Go ahead. You're on mute, Kesh. No, you went away and you're still on mute.
Can you see me now?
Yes.
Okay. Okay. So for me, I working in this field and seeing so many diagnoses coming up, like it was kind of in my face. And so it was like I couldn't ignore it in a way, like, okay, this doesn't exist. It does. For me, I talked to my partner. My partner is trans. I'm poly and pan, so I know that, you know, there's a lot of things going on and having paperwork and having all those things protected, but there's times where you're not, you know, things slip up. And so for me, it was important that if I'm talking to my patients and I'm speaking on, you know, different things, that I'm doing what I'm talking about as well. So it was really important to, you know, to have that type of control over my body and know that I'm doing as much as I can to be a very responsible, sexually active person. I think we have to get real. People are having sex. And I think that when we put little limitations or expectations, oh, you're a woman, you're a Black woman, you shouldn't be out there having sex, it just puts us in more danger. We are having sex, we're enjoying sex, but we need to be able to do it in a way that we're protected as well. If I get up, I'd rather just get up with a heartbreak than to get up with HIV and the heartbreak. So, you know, it was important for me to protect myself and my partner and also be able to have a healthy sex life with several partners if I chose to.
So I'm curious because you know, so far, Toya, you're in the field, Kesh, you're in the field. I don't remember, Terry, to maybe tell us a little bit of your story about how you got to PrEP. And I have a question for Jazmine. Go ahead, Terry.
Sure. So I ended up, it's a crazy story because I was just new to and introduced to a lot of the Ron White funding. And so it allowed me to just kind of open the door to get more research about just the HIV community, the services. And so as a consumer, I just don't think I would have taken the time to get that much knowledge, right? But because it was part of my career, I had to get the information. And it just so happened that I started dating someone that was HIV positive. And I did not know their status at first, But then I wanted, of course, they disclosed it at some point. And it was a dilemma for me. I think that as a community, we want people to be honest and communicate, but can you really handle that truth when it comes your way? And so you have to appreciate that. And I had to make a decision if that was something that I wanted to do. And what was so funny, but probably like a week before that, we were just having a general conversation, some friends and I, and they said, would you, have interactions with someone who was undetectable and disclose their HIV status to you? And personally, I said, oh no, why would I do that? Like, I don't have to make that type of choice. I'm not doing that. I don't know if I felt like I was too good or, no, I don't know what that was. But as I sat back and the more and more that I did work in my professional realm, I felt ignorant. I felt that I was doing a disservice to myself, and I felt like a hypocrite because personally in my life, I was closed off in that section. But professionally, I'm open, I'm educating, I have the information. And how could I do that if I wouldn't, embrace those type of things in my life personally? So there you have it. I made an appointment with my medical provider. And of course, it hit different when it's you, right? So I'm in the office, I'm asking 10,000 questions, right? I just want to know. And actually, all I was doing was confirming the research and with the information that I was provided already, right? And I ended up taking PrEP. And it was a good decision. It was one of the best decisions. And now I wonder to myself, even not having interactions and dating that person that was HIV infected, I felt like, what's the point of me getting off of it now? Not that I am condoning any type of risky behavior, or I'm not going to be health conscious about what's going on with me. However, I do feel like it was an extra shield and an extra barrier, and I was more connected to my health. And I just started wondering, why aren't they sharing this with more people? I think at large, they're just a little scared that people may misuse the tendency for PrEP and not look at those other things like STDs and just how we handle healthy relationships in general. Just because you feel like, well, if I take PrEP, I know at least I'm covered here so I can do A, B, and C. I don't know what that miseducation is about, but I definitely am an advocate for PrEP. And just as a people, a society in general, we want people to have equity and those type of things. So get the information to them. Let people know what's out there for them. I had to go to my provider, and my provider is awesome. You asked me, but I didn't see it anywhere, anything about PrEP. It took for me to run into that personal situation for me to go seek the information. Yeah.
Helpful. I'm wondering, before I get to Mickey, and I hear that Sarah's on, I'd love to talk to Jazmine, because I think, we have a very, you guys are the choir, right? People who are working in the field or something. And Jazmine, I know your mom works in the field, but you are probably the youngin on the call, and wondering what your thoughts are about the messages are getting to young women. What have you heard? Do people think, young women, you're in high school, and what do they think this is a thing for them? Are they getting the messages or concerns that you're hearing the women talk about?
My school really didn't disclose any information about any preventions, or they brought up condoms and things like that, but they haven't brought up real deal preventions or that can really, really help us. It's just, just the condoms. And I feel like they should just do a little bit more. I've learned everything from my mother. So it's like, I can't really speak on everybody from the school because I've only talked to my friends about it and they've talked to me about it. So I'm not really, really sure about the school.
Yeah. Okay. So I'd love to maybe hear from Mickey and Sarah just about how providers are interfacing with patients and making decisions about who to bring PrEP up to or not, because it feels like we might be part of the problem. I'm curious what your thoughts are about how people choose to who to talk to about and what we as providers can do differently. Welcome, Sarah. Go ahead, Mickey.
So I think that's a great question. And and as I am conducting my study in Baltimore about PrEP, even acceptability, some of the focus groups we conducted early on, I think one of the biggest theme that we keep hearing this narrative over and over again, one of the biggest theme came out of was provider knowledge and awareness. In 2023, who would have expected, right? We were just conducting these focus groups, and I think when I see patients in early on, when it struck to me, when I finished my training at Hopkins, I started working at Chase Brexton. One of my very first patient who was assigned female at birth, identified as a cis woman, and came to me and just for regular care. At the time, I was doing more primary care than HIV and prevention. Now I'm like fully into HIV and prevention only, and I started asking her about just general questions, but then I spent about 10 minutes discussing like sexual health. She was just sitting there looking at me and be like, nobody has ever spent so much time asking about my sexual health. Like, why are you so interested? She was almost intrigued. And then I think the way we are trained, and we all train different ways, we go to different training programs, and I think primary prevention it's key to my heart, and I hope a lot of providers. And I started discussing in terms of what prevention is, from vaccines to chemo prevention, like PrEP and things like that, and when we talk about sexual health, condoms, but what other ways we can protect ourselves, just even opening up to conversation with our partners. So this has been what my practice that opened my eyes in my very first year of practice, and I've been doing that since then. I've seen that through these conversations that patients, especially women, because historically our focus has been on men, and when we focus so much on just one subpopulation, we end up ignoring others, and that's what we've done as a system. And now I've seen that time after time that people feel empowered, and they feel confident in their health, and they're more aware of their own health when we discuss not just their regular pains and other chronic conditions, but about just talking a little bit about their preferences, their sexual health, or simple questions like, how's love life? Something like that opens up a whole new conversation in a visit. And I think that's where it needs to start when we talk about, how primary prevention sexual health needs to really invade within primary care, within OBGYN care. I think that's another area where lacking so much of primary prevention when we talk about sexual health. So this is what I have done. This is what my recommendations are moving forward, at least for now.
Yeah. Sarah, anything to add to that? I mean, particularly, again, beyond our, STI clinics or sexual health clinics, what would your advice be on how people are approaching, particularly women, but individuals who may benefit from PrEP?
I mean, I think we know that so many different people can benefit from PrEP, and we know we are biased as providers in what we think someone is doing or could benefit from. And we have this, in the back of our mind, who it is who's getting HIV, and we're not always right about that. And that's why I like to have QA projects, have data, be objective about it, have a champion at a clinic that's looking at who had gonorrhea and were they offered PrEP, just really take it down to the objective information to check ourselves and say, okay, are we really discussing this with everyone?
Yeah. I'm curious from our panelists, are there anybody who brought it up and got pushback from their doctor? Did your provider bring it? Oh, Kesh, I want to know who brought up in the conversation and how that was met. Go ahead, Kesh.
So I did my research, and I had already discussed with my partner, and they're trans. And when they asked for a PrEP, they was giving in all the information, boom, boom, boom. A month later, when I went in and saw the provider, he straight up told me he's never prescribed PrEP for a cis woman. And it made me feel in the way that it was like such a weird thing that I was in there. It made me feel like, is it okay? Am I allowed to be in this club? he just, was like, I just don't feel comfortable, speaking with women. I just feel like it might not be appropriate. And I'm a patient right now. You're saying this to me, and I'm already prepared. And like, I'm going to get this. But if I didn't have the information that I did on my own, I definitely would have been talked out of it, as if, I mean, it was even to a point was, are you a sex worker, to make it make sense of why I'm asking for a PrEP? I'm like, no, I'm not a sex worker. I just want, and I had to like tell him the benefits that I've seen from taking PrEP. And it was, I just imagine if I wasn't who I was and I didn't do the research that I did, that I absolutely would have walked out of there like, oh, this is not for me. This is for the others. And would have put me in a situation that could have put me in danger, down the line. But it was really shocking that I almost had to justify why, as a Black cis woman, wanting to take PrEP without having the other things that are typical for people who take PrEP.
Right. Wow. I did not get to introduce Jocelyn. Jocelyn, I wonder if you can introduce yourself briefly and then tell us about your experience accessing PrEP. Jocelyn?
Thank you so very much. I'm so sorry. I'm like, is it me? I don't have any experience with PrEP. I did have questions prior to possibly using it. That's what I felt like my contribution to the panel would be. Just questions about like using it, how to begin the conversation with my doctor, what's the appropriate doctor I should go to, excuse me, and possible side effects.
Love it. So why don't we jump into thank you for that. We invited people of all walks, so current, past, future, to share their experiences. So Toya, I think I saw you coming off camera talking about how you access, and then I'd love to move into some how you feel on PrEP, etc. Go ahead, Toya.
I kind of feel like when Sarah gave us the numbers in the presentation, like the disparities of the women and the different races that have access to it, and the numbers were vastly different. And then actually having the experience of going to a provider and none of them introducing PrEP to me or saying anything about it. Me having to actually say, hey, I reached out to a PrEP coordinator here at work, just to get some information on where I could go and how I could get started. And that process, it was interesting. Once I reached out to her, I was immediately brought in, and we started pretty much right away. The doctor did provide, she took a really thorough sexual history questionnaire just to know like how best to provide care for me. And I really appreciated that. But no one is like, Mickey stated, like just taking that time to be really intentional with your care, that you did care enough to take the time to ask and to provide information so that I can protect myself. That was really important to me. But no other provider had done that before. And I kind of think it really is a big injustice to us. And I don't know if that is something that providers feel a way that they don't know how to approach the situation or approach that conversation with young women or older women, whoever that could benefit from PrEP. I don't know why that is. But hopefully with this conversation, providers would do more to increase their engagement with PrEP and understanding that it is something that should be provided to women, especially that we know that it is available.
I wonder if anybody else wants to chime in, please go ahead and jump in terms of their experiences accessing. But I'd love to get to Jocelyn's question about, well, how has it been for people on PrEP? Any side effects people have had? That's one. And then maybe Mickey and Sarah, you can jump in terms of common things you see and what you advise people in terms of as they're starting and how to manage. So maybe first, how has it been? Anybody grow a third eye or anything like that on it? How has it been for people being on PrEP?
Yeah, so I'll jump in there. And really, I'm laughing, but it's really serious. You have to be an advocate for yourself in a sense. And so I only hope that people that are seeking the information, can just feel that empowerment, because that's what you want to know. I'm very reluctant as a Black woman to, what's this medication? Same way I was about, what is this COVID-19 shot? What is when I take the flu shot, I get the flu, just misconceptions, whatever that is, right? So I just wanted information. What is it? Some of the past HIV medications I know did some things with bone density and bone loss to some of the people that were taking HIV medications. And so I took that into minds and said, hey, what are they doing? PrEP has to be similar and has some of the same ingredients. What's going on? We hear commercials on the TV. Get this, but you hear all the side effects and you're like, well, the side effects are worse than what I'm trying to treat or what have you. So I was very skeptical. Once again, your own research, you don't get a peace of mind really till your medical professional can really solidify some of those things. So far, I want to start me getting it. It was different because one, I wanted to hide my medication. I had a young child, a teenager in the house too, and I didn't have those open conversations about my healthcare and my sexual health practices. Just in general, I did, so it was a little different. So it was a different feel. Me where I was placing my medication at was like a little top drawer in the corner, so in case she just happened to go in there for any reason, it wouldn't be accessible for her to be like, well, what is this? I don't see, my mommy doesn't take any medications. What is this, right? So I wouldn't have to explain it to anybody. So that's that stigma around that. When I first started taking it, they did say that you could have some very mild side effects, like a week or two of taking it. I had absolutely none. And so far, I absolutely have had none, and I continue to take it. The only kind of issues that I run into, my provider, like I said before, was great, but indirectly, and I think that's just the customer service of our providers that we have. When I go to schedule my 3 months, because with PrEP, you have to take your labs every 3 months. That's kind of like a checks and balances, how's everything going health-wise? It's a great plus, right? Because medical coding allows me to get my, just my vitals and my labs checked every month, just a kind of an auto health checkup, I look at it as. But my schedulers, I need to schedule a 3-month follow-up. Miss Gross, what are you coming in for? So somebody who's new or doesn't know, they like looking through my system, looking through codes. And, I've heard somebody say, oh, you coming in for that kind of follow-up. And it threw me back for a minute, right? But other than those little things, it has been an easy process. And so I encourage a lot of people to connect with it if they can.
Okay, great. So what I heard was a lot in there. I heard not any major side effects at all, and Mickey or Sarah can speak to some that people can see and how long you may have those. But I heard some shaming, and I heard some barriers in terms of logistic barriers in there that I would love to explore a little bit. So Mickey or Sarah, want to jump in about any side effects, particularly for Jocelyn, who's somebody who's considering PrEP? What do you counsel people about, and what do you normally see?
Yeah, okay, Mickey, you didn't unmute first.
Go ahead.
I typically talk about, headaches, stomach upset, some typical symptoms that can happen when you're starting a new medication. Those are more common. And then the more serious but more rare things that can happen with a medication like tenofovir, as far as the concerns with affecting kidneys and bones. But I also talk about how these medications have been used for many years among millions of people as part of HIV treatment across the world, and as prevention for a long time now with great safety. So, and that we use things like the routine monitoring when we're concerned to make sure that this isn't happening to someone, as far as the concerns with kidneys. Yeah, I don't know, Mickey, if you have more that you go into, but that's kind of my basic approach. And then it's really tailored based on that person's particular concerns.
No, I absolutely agree with you. I think in terms, a lot of people come in because everything on social media come in with, oh, it's going to damage my kidneys. I want this pill or that pill, or I want, now it's injectable is available. So I think really informing patients about what current data is available. I think we continue to get data. In fact, this about a couple of days ago, I think there was a modeling study came out looking at really if there were differences between Truvada and the tenofovir alafenamide Descovy, like in terms of kidney and bone issues, and they're seeing that there is really not differences clinically speaking, and we really need to offer that information to patients so they can really make an informed decision, and really taking that scary feeling away. That's how I sort of sit down, have in-length conversations about what it means and something, this is not being lifelong, or, in terms of medication, situations change, medication can be taken off. And also I think about when I talk about sexual health in general, some people who are very hesitant to start PrEP, I talk about, if you were at potential for HIV acquisition and, thinking about, yes, if you do get it, then you'll be on treatment for lifelong, right? And considering PrEP, which could be a short term. So thinking from that perspective, also, I think a lot of people feel very comfortable and confident in starting. So that has been my approach. But I also wanted to make a very small comment about Toya when she was talking about access. I also wanted to just share my recent experience with access is that, access comes in very different forms, not just providers. Access also comes from knowledge. I'm always taking classes, Bloomberg School of Public Health, and I'm recently taking a women's health class actually, and we're discussing everything related to women's health. And I think what we're realizing in talking that gender power relations, right, in not just exclusion from research, but also in classrooms, who's sitting on the table. I am the only, cis man in the room. And when we start talking about HIV prevention, 0 students at Bloomberg School of Public Health knew about prevention.
Wow.
0 women sitting in that room. Some said, oh, I've never heard about it, but even the professor said, you have to take it right before sex, So I think these are the conversations need to penetrate in the system. Our medical system is not a public health system, and we need to change that. So I just wanted to just comment on that.
But I think Marina's just texting me going, my goodness, we might need a part 2 for this because there's so much rich, I think, experience and I think advice for how we could approach it. So I would love to hear from particularly our panelists who are thinking about PrEP or on PrEP or have been, and reflecting on the many commercials that we now see on PrEP, because again, many of you are in the field and are seeing that. But when you see those commercials or when you see the messages, do you see yourself in them, and do they resonate with you in terms of, yes, PrEP is for me? I would love to hear people's thoughts, and what would we recommend to change those? Kesh, you came off on camera really quick, so go ahead.
No, it doesn't look like it doesn't look like us. It doesn't look like me. It doesn't look like, a regular mom that, it doesn't look like it's for us at all. Most of the commercials and things you see is gonna be white gay men. So I'm not that. So it just looks like it's just not something that's made for me.
Yeah. Anybody else want to chime in? And I do have another question. There's some questions in the chat. Okay. So
I haven't
go ahead,
really
Jazmine.
seen, I'm sorry. I
No,
haven't
go ahead.
seen any commercials really. I just feel like they should just put some up in the schools, like posters, banners, like things like that. Because we look in school, they tell us things, but they don't really, I don't know, they don't push it on us. So like if you don't push it on us, we don't really know how to handle certain things. And I feel like, yeah, we should just, yeah.
So I think, go ahead, Toya.
I was
You're
going to
in that school,
she
so
feel like it's not that important if they don't. You feel like it's not that important if they don't push it or say this is something that you should really look into. So if it's briefly said to you and then it goes away, then it's like, okay, that's great information. But if it doesn't come back, it's like, oh, it isn't a big thing. Is that what you were trying to say, Jazmine?
I was trying to say we don't get any information at all.
Okay.
So it's like they should push that on us anyway.
So I'm looking at Sid Rosen's comment in the chat, and I'm assuming Sid has tried to interface with the schools. There's a lot of pushback. I mean, I think we happen to be in Maryland where we can even have any conversations about school, but you can't say the S word or the G word or any words in some states in the United States and even in some places in Maryland. So how do you get it to in front of people, and particularly young people, those messages? And then what are the places? I always say, if Beyonce or Sexy Red was talking about PrEP, we would be all using PrEP. But how do we get that to the people that really need the messages? My little young people don't watch TV, so they're not seeing the commercials. So I think really important. I want to make sure I highlight some questions in the chat. I think it was when might have been Kesh talking about, or Jazmine talking about discretion, would her daughter see it? It was Terry. Would her daughter see, or her child see that the PrEP was there? We know their injectable PrEP is now available, and curious for people interested in PrEP or those on, is injectable PrEP something that intrigues you at all? And if yes, why? Toya, you came up immediately, so maybe go on and say, and then Terry, I'd love to hear you follow up with that.
Oh, well, you could go ahead, but Terry, if you want to go.
Go ahead, you on, go ahead.
Could you repeat the question? I was answering.
Yeah, so Terry had mentioned a lot about discretion and being concerned, and I was going to ask about PrEP shaming, because that was something that we had, early on the PrEP, sort of PrEP use. But one to talk about injectable PrEP, which is a shot you could take once every 2 months without taking oral pills, right? And is that something that appeals to people, or something that makes you nervous? Curious what your thoughts are about that.
Absolutely. I love the idea of, when I started PrEP, I did do the pills. We did that just to make sure the insurance company wouldn't deny me, because I knew the injection was available. And I really wanted that, because I am not great with taking pills or hiding them. Just not used to it. So the injection would be ideal for me. I didn't feel, well, I did. When I went to go get the injections, I had to sit within the clinic, and I was like, well, I don't have anything, or when I look at my papers, it says like infectious disease, and I'm like, I don't have that either. Or when I go to my provider outside of PrEP, and they look at my chart and they can see the medication I'm taking, some of them don't know that it's a prevention med, and so they're asking like, oh, well, what's your viral load? I'm like, I don't have one, I'm taking it for prevention. So I know that it's just not out there. But in reference to me personally feeling stigmatized or anything like that in reference to taking PrEP, I don't, because that's a decision that I make. And then however people feel, it's really just on them. I don't personally feel, I feel like I'm being empowered by the choices that I made, especially in regards to my health.
Terry, did you have something to add to that? You on mute.
Yep.
You said Terry?
Yep.
Go ahead, Terry.
Okay. I just wanted to share the update about the injectable piece of it. I also saw the commercial and I was like, oh, that's great. I knew a little bit of talk from some of the pharmaceutical companies was happening just professionally wise. They've been doing a backlog of it for the past 2 years. And so now it's kind of the introduction, what have you. But I tried to follow up on my 3-month visit and inquired about it. It was more like, yeah, it takes a lot for the insurance company to approve it. They did look to see that my particular insurance carrier do it. And I think they told me no, or we could try it the next time and see if it goes through, something to that effect. So it was a little leery for me. I would like to try the injectable piece of it. And I just want to talk about just another barrier too. We talk about the community at large, and people are going to their pharmacies in the community. So I'm glad that they have pharmacy delivery, prescription delivery services, that type of thing. Because I go to my local community pharmacy and I go pick up my medication. And lo and behold, I just went 2 months ago and my daughter's best friend from high school, mother, works there at the counter when I go to my pharmacy. And so she's the person that I'm saying, yes, my last name is Gross. Yes, and she's getting my medication for me. And even though she handles it with grace and professionalism, as she should, right? She's human. So at the end of the day, if she wanted to remember, hey, I know that's my best friend, my daughter's best friend mom. And she's taking that medication that begins with, a T, she got that Truvada. Let me look on my phone and see what that is. Oh, I look at those things, but you expose yourself like that with anything that I have. And I'm not trying to be graphic. Suppose I went and picked up, I don't know, yeast infection medication. So it's a stigma with everything. But I turned that feeling into something positive because I want to be proud that I'm on PrEP. I look at it as I am being responsible for my health. And if I'm going to be ashamed about that, well, then that's a problem. So that's where I want to kind of educate people and make them feel the empowerment for taking a risk, first of all, by all these other barriers that are around them, and they still say, I choose me first. I choose to make sure my health is this. I choose to interact with my partner. I choose to do this, in an open world where so many things are going on. HIV is not the end all of everything. And so if we truly are being equitable to everybody, we're, as people taking PrEP, covering ourselves, people thinking about PrEP or being proactive, and those people who are HIV infected and undetectable or doing the steps they need to do. It's not the end of life for them. And I want people to get that information.
So I cannot believe we are done because it's an hour, and we definitely need a part 2 because I think we need to talk more about people's experiences and really give people an opportunity to come on like Jocelyn to ask more questions. There have been a lot of questions in the chat about access issues, in terms of getting to the injectable. How do you get, the people's PrEP paid if they actually have insurance? And thank you, Sarah and Mickey, for answering some of those in the chat. Hopefully we will share those posts and give people access to those links. We'll keep the chat. But thank you everybody for sharing your experiences. This was amazing, not enough time. And I think, next time, because I think we're going to try to do a part 2 of this, we clearly have people who have identified they have need. There are some barriers and we need to help people get through those barriers. Mickey, your sex talk needs to go to every provider so they know how to do that and to make people feel comfortable and welcome. And Kesh, Toya, Jazmine, in the future, really empowering people to push us as providers to get you access to what you need. And I hear it also diversifying where you get that to avoid stigma, but to also optimize access. Thank you, everybody, for your participation, your stories, your PrEP tales. Please, we will be sending out the recording to those who signed up. Let us know if there are other things you want to hear about, and if you have things you want to share for us. What is up on deck for next month, Marinas? And again, thank you, everybody. Marinas?
Thank you.
Thank you.
Thank you.
Next month is rural health with David Griffith, right?
Yes. Sorry. Yes.
Yes, no worries. Thank you, everybody. Really appreciate your time. And we'll follow up with you all. Please fill out those evaluations when you get them. Let us know what else you want to hear. And again, it has been an absolute pleasure to have this conversation about your PrEP tales and beyond. See you next time.